Hello everyone, now let us discuss about 2023 CPT coding guidelines for echocardiography. Echocardiography includes obtaining ultrasonic signals from the heart and great vessels with real-time image and or Doppler ultrasonic signal documentation with interpretation and report. When interpretation is performed separately, we need to use the modifier 26 to indicate the professional component. A complete transthoracic echocardiogram without spectral or color flow Doppler, which is nothing but given by the CPT 93307, is a comprehensive procedure that includes two-dimensional and, when performed, selected M-mode examination of the left and right atrium, left and right ventricle, the aortic, mitral and tricuspid valves, the pericardium and the adjacent portions of aorta. Multiple views are required to obtain a complete functional and anatomical evaluation, and appropriate measurements are obtained and recorded. Despite the significant effort, the identification and measurement of some structures may not always be possible. In such instances, the reason that an element could not be visualized must be documented. And additionally, structures that may be visualized, for example, pulmonary veins, pulmonary artery, pulmonic valve, inferior vena cava would be included as a part of service. The next is a complete transthoracic echocardiogram with spectral and color flow Doppler, which is given by the CPT 93306, is a comprehensive procedure that includes the spectral Doppler and the color flow Doppler in addition to the two-dimensional and selected M-mode examinations when performed. And the spectral Dopplers 93320 and 93321 and color flow Doppler, which is given by the CPT 93325, provide the information regarding the intracardiac blood flow and hemodynamics. Next is a follow-up or limited echocardiographic study, which is given by the CPT 93308, is an examination that does not evaluate or document the attempt to evaluate all structures that comprise the complete echocardiographic exam. This is typically limited to or performed in follow-up of a focused clinical concern. The next is in stress echocardiography, and echocardiographic images are recorded from multiple cardiac windows before, after and in some protocols during the stress. And the stress is achieved by either walking on a treadmill or using a bicycle, supine or upright, and or administration of pharmacological agents that either stimulate exercise by increasing the heart rate, blood pressure or myocardial contractility, or altered the coronary flow by vasodilation. The stress can be achieved by these ways. The patient's ECG, heart rate and blood pressure are monitored at baseline throughout the procedure and during recovery. And the reports are prepared to evaluate the duration of stress, the reason for stopping, and the hemodynamic responses to the stress, the electrocardiographic response to stress, and the electrocardiographic and echocardiographic response to stress. Reports are prepared to evaluate all these things: the duration of stress, reason for stopping, and the hemodynamic response to stress, the electrocardiographic response to stress, and the echocardiographic response to stress. When a stress echocardiogram is performed with a complete cardiovascular stress test, stress echogram is performed with a complete cardiovascular stress test, continuous electrocardiographic monitoring, supervision, interpretation and report by a physician or other qualified healthcare professional. Then you need to report 93351. Whenever a stress electrocardiogram is performed with a complete cardiovascular stress test, you need to report 93351. When only the professional components of a complete stress test and the stress echocardiogram are provided. Example, in a facility setting by the same physician, You need to use modifier 26 along with 93351 when only professional components of a complete stress test and a stress echocardiogram are provided. In such instances, by the same physician, you need to report 26 modifier along with the CPT 93351. When all professional services of a stress test are not performed by the same physician performing the stress echocardiogram, then use 93350 in conjunction with the appropriate codes for the cardiac stress test, which are given by 93061 93018 for the components of cardiovascular stress test that are provided. Whenever stress echocardiogram and a complete cardiovascular stress test are provided by the same physician in a facility setting, then you need to report 93351 with 26 modifier. And second case is when the professional services of the stress test are not performed by the same physician performing the stress echocardiogram, then you need to use 93350 CPT in conjunction with the appropriate codes for the components of cardiovascular stress test that are provided. You need to use 93350 in conjunction with either the code 93016 or 93018. 93016 to 93018. You can use any of the code in that range. The next point is when the left ventricular endocardial borders cannot be adequately identified by the standard echocardiographic imaging, the echocardiographic contrast may be infused intravenously. Echocardiographic contrast may be infused intravenously both at rest and with stress to achieve that purpose. And the code 93352 is used to report the administration of echocardiographic contrast agent in conjunction with the stress echocardiography codes, either 93350 or 93351. And the supply of contrast agent and or drugs used for pharmacological stress is reported separately in addition to the procedure codes. The supply codes for drugs are reported separately in addition to the procedure codes. And whenever left ventricular endocardial borders are not visualized, then you can use echocardiographic contrast. Next code is 93355 is used to report transesophageal echocardiography TEE services during the transcatheter intracardiac therapies. It is reported once per intervention and only by an individual who is not performing the interventional procedure. And the code 93355 includes the work of passing the endoscopic ultrasound transducer through the mouth into the esophagus when performed by the individual performing the TTE, diagnostic transesophageal echocardiography, and ongoing manipulation of the transducer to guide the sizing and or placement of implants, determination of adequacy of the intervention, and the assessment for potential complications. This CPT includes all this work: passing of the endoscopic ultrasound transducer through the mouth and diagnostic transesophageal echocardiography, and the ongoing manipulation of the transducer to guide the sizing and or placement or determination of the adequacy of the intervention or assessment for the potential complications. And this code 93355 is reported once per intervention and only by an individual who is not performing the interventional procedure. It is used in conjunction with the transcatheteral intracardiac therapies. Real-time image acquisition, measurements and interpretation of the image, documentation of completion of the intervention, and final written report are included in this code. A range of intracardiac therapies may be performed with the TTE guidance, and the code 93355 describes TEE. A range of intracardiac therapies may be performed with TEE guidance, esophageal echocardiography. And the code describes, code 93355 describes TEE during advanced transcatheteral structural heart procedures. For example, transcatheter aortic valve replacement, TAVR, left atrial appendage closure, LAA, or percutaneous mitral valve repair. The next is C93313 code for separate reporting of the probe insertion by a physician other than the physician performing the transesophageal echocardiography. If another physician is inserting the probe, then you need to see the CPT 93313 other than the physician performing the TEE. Report of an echocardiographic study, whether complete or limited, includes an interpretation of all obtained information, documentation of all clinically relevant findings, including quantitative measurements obtained, plus a description of any recognized abnormalities. All these things must be included in the report. Pertinent images, videotape and or digital data are archived for permanent storage and are available for subsequent review. And use of echocardiography not meeting these criteria is not separately reportable. Next is use of ultrasound without thorough evaluation of organs or anatomical region, image documentation and final written report is not separately reportable. And for fetal echocardiography, we need to see the codes 768252, 76828. Now let us see the various CPTs. The first one is 93303. Transthoracic echocardiography for congenital cardiac anomalies. Complete. Transthoracic echocardiography for congenital cardiac anomalies. Complete test. Next is the follow-up or limited study. The CPT is 93304. The next is 93306. Echocardiography transthoracic real-time with image documentation. 2D includes M-mode recording when performed, complete with spectral Doppler echocardiography and with color flow Doppler echocardiography. This is with the Doppler studies. 93303. 2D imaging, M-mode recording and along with it spectral Doppler echocardiography with color flow Doppler echocardiography. And next CPT is 93305. Echocardiography transthoracic real-time with 2D imaging including M-mode recording when performed, complete without spectral or color Doppler echocardiography. Without Doppler studies, you need to report 93307. And with the Doppler, you need to report 93306. The next CPT is 93308. Echocardiography transthoracic real-time with image documentation including M-mode recording when performed, follow-up or limited study. The next is 93312. It includes echocardiography transesophageal. Previously it was transthoracic. Now transesophageal real-time with image documentation with or without M-mode recording, including probe placement, image acquisition and interpretation and report. And do not report 93312 in conjunction with 93355. The next is 93313. It includes echocardiography transesophageal real-time with image documentation for placement of esophageal tube only. This is given only for the placement of transesophageal probe. And the same individual may not report 93313 in conjunction with 93355. That is also important point. Next CPT is 93314 for image acquisition and interpretation and report only. Previous echocardiography For image acquisition, interpretation and report only, you need to report 93314. For probe acquisition, you need to report probe insertion only, you need to report 93313. The next is 93315. Transesophageal echocardiography for congenital cardiac anomalies, including the probe placement, image acquisition, interpretation and report. This includes all of them. For congenital cardiac anomalies, the CPT is 93315. And for placement of transesophageal probe only, for transesophageal echocardiography for congenital cardiac anomalies, for placement of probe only, you need to report 93316. And for image acquisition, interpretation and report only, you need to report 93317. The next is an add-on code plus 93319. 3D echocardiographic imaging and post-processing during the transesophageal echocardiography TEE or during transthoracic echocardiography for congenital cardiac anomalies for the assessment of cardiac structure. For example, cardiac chambers and valves, left atrial appendage, interatrial septum, interventricular septum and function when performed. List separately in addition to the code for echocardiographic imaging. And you need to use 93319 in conjunction with 93303 or 3304, 3312, 3314, 3315 and 17. And do not report 93319 in conjunction with 76376, 76377, 93325 and 93355. It is a 3D echocardiographic imaging and post-processing during either TEE or during transthoracic echocardiography for congenital cardiac anomalies. The next is 93318. Echocardiography transesophageal for monitoring purpose, including probe placement, real-time 2D two-dimensional image acquisition, interpretation leading to ongoing continuous assessment of dynamic changes, cardiac pumping function and to therapeutic measurements on an immediate time basis. This is for monitoring purpose only. TEE for monitoring purpose only means you need to report 93318. This includes the probe placement, 2D image acquisition, interpretation and assessment of cardiac pumping function and to therapeutic measures on an immediate time basis. The next is an add-on code plus 93320. Doppler echocardiography, pulsed wave and or continuous wave with spectral display. List separately in addition to the codes for echocardiographic imaging complete. Use 93320 in conjunction with 93303, 04, 12, 93312, 93314, 1517, 93350 and 93351. And you should not report 93320 in conjunction with 93355. This is Doppler echocardiography. The next is an add-on code plus 93321 for follow-up or limited study. Whenever Doppler echocardiography complete means you need to report 93320. Doppler echocardiography follow-up or limited study means you need to report 93321. Both are add-on codes only, must be coded in addition to the codes for echocardiographic imaging. And these are the list of codes in conjunction to which you can use 93321. Important point is you should not report 93321 in conjunction with 93355. The next CPT is 93325. Doppler echocardiography color flow velocity mapping. And use 93325 in conjunction with all these listed CPTs. And do not report 93325 in conjunction with 93355. The next is 93350. Echocardiography transthoracic real-time with image documentation includes M mode recording when performed during rest and cardiovascular stress test using treadmill, bicycle or pharmacologically induced stress with interpretation and report. And stress testing codes 93016 and 93018 should be reported when appropriate in conjunction with 93350 to capture the cardiovascular stress portion of the study. And do not report 93350 in conjunction with 93015. The next CPT is 93351. This is a continuation CPT. This is echocardiography, transthoracic, real-time with image documentation 2D. It includes the M mode recording when performed during rest and cardiovascular stress test using treadmill, bicycle or pharmacologically induced stress, including the performance of continuous electrocardiographic monitoring. This includes continuous electrocardiographic monitoring with supervision by physician or other qualified healthcare professional. And do not report 93351 in conjunction with 93015 to 93018 or 93350. And do not report 93351 along with 26 modifier in conjunction with 93016, 18 and 9335026. It includes the continuous electrocardiographic monitoring with supervision by physician or other qualified healthcare professional. The next CPT is 93356. This is an out of numerical sequence, hence it is indicated by number sign. This is also add-on code for myocardial strain imaging using speckle tracking derived assessment of myocardial mechanics. You need to list separately in addition to codes for electrocardiography imaging. Use 93356 in conjunction with 93303, 04, 06, 07, 08, 93350 and 93351. And report 93356 once per session only, not more than once. The next is also an add-on code plus 93352. Use of echocardiographic contrast agent during the stress echocardiography. Whenever the ventricular cardial borders are not visualized, we have discussed that we will induce a contrast. So whenever contrast agent is induced or infused, then you need to report 93352. Use of echocardiographic contrast agent during the stress echocardiography. Use 93352 in conjunction with 93350 and 51. 93351 and 93350. Do not report 93352 more than once per stress echocardiogram. That is also important point. The next is 93355. Echocardiography transesophageal TEE for guidance of a transcatheter intracardial or great vessel structural interventions. Example TAVR, transcatheter pulmonary valve replacement, mitral valve repair, paravalvular regurgitation repair, left atrial appendage occlusion or closure, ventricular septal defect closure, peri or intraprocedural, real-time image acquisition and documentation, guidance with qualitative measurement, probe manipulation. Probe is included in this code 93355. Probe manipulation, interpretation and report, including diagnostic transesophageal echocardiography and when performed, administration of ultrasound contrast, Doppler, color flow and 3D. All are included in this CPT 93355. It is administration of ultrasound contrast is included, Doppler studies are included, color flow, 3D, probe manipulation, interpretation and report. And to report the placement of transesophageal probe by separate physician. If separate physician inserts the probe, if same physician inserts the probe, and performs the echocardiography TEE for the guidance of these procedures, you can use only one code 93355. But if separate physician inserts the probe, then you need to use 93313. And do not report 93355 in conjunction with 76376, 76377, 93312, 93313, 93314, 93315, 16, 17, 18, 20, 21 and 25. Now let us see an example. A cardiologist pediatrician sends a 4-week-old baby to an outpatient facility to have an echocardiogram. And the baby has been having rapid breathing, he is sedated and a probe is placed on the chest wall and images were taken through the chest wall. A report is generated and sent to pediatrician. The interpretation of the report by the pediatrician revealed that baby had a atrial septal defect. And choose the CPT code for cardiologist pediatrician. Here cardiologist is performing, the pediatrician cardiologist is performing an echocardiogram to evaluate the congenital cardiac anomalies. And a complete test is performed because probe was placed and images were taken through the chest wall and the report is generated. And one more important point is, whenever interpretation is performed separately, you need to use 26 modifier. Here the interpretation of the report is performed by the pediatrician and it revealed that baby had atrial septal defect. So the appropriate CPT is 93303, transthoracic echocardiography for congenital cardiac anomalies complete, along with 26 modifier to indicate the professional component. The next example is also for 93303. A patient has a complete TT, that is transthoracic echocardiography. Complete transthoracic echocardiography performed to assess her mitral valve prolapse and it is congenital. And the physician performs the study in his cardiac clinic. So the appropriate CPT is 93303. Transthoracic echocardiography for congenital cardiac anomalies complete. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.